You don't have to go through menopause or perimenopause miserably. A lot of women will say, I don't feel like myself anymore. And it is true.
Join me, Dr. Mpume Zenda, as we unpack what perimenopause and menopause really mean.
Except with the perimenopause and menopause, it is happening literally. It's the finale, it's the grand finale. We are closing factories, we are shutting down.
How symptoms show up, and explore the support options available to help you navigate this phase with confidence.
It's so important for women to understand all the options that are available to them. Let's have the conversations, let's educate, let's give accurate information, particularly as clinicians. The difference between perimenopause and menopause. Perimenopause is the time preceding the menopause. Let's define menopause in itself. It is when a woman has had 12 consecutive missed menstrual periods. Now we say you have menopause. Yes, it is a retrospective diagnosis. But prior to this, what you get is a span of anything between 4 and 8 years where the hormones have started to decline, particularly the estrogen, progesterone, and testosterone. And therefore, they may start having symptoms even though they are still experiencing their period. That is the big difference between perimenopause and menopause. Women can still be in perimenopause or in the perimenopausal phase and still have regular periods. Although when you kind of look at the way that the menstrual cycle changes, yes, from the time that those hormones start to decline, there are changes. So it may become a little bit more in terms of the number of days or the heaviness of the bleed. It may also change in sometimes the closer they get to the menopause, they start missing periods or menstrual periods 1 or 2 months in between. But the earlier it is, so looking at, for example, somebody who's between like 38 and 42 to 43 years of age, please be mindful. You may have a regular period, which means you still need to be protected from an unwanted pregnancy if you're still doing nice things. When it comes to age where people or women may start experiencing symptoms, it really depends in terms of where they are in their phase. With the menopause, there are definitive symptoms. Again, not every woman will experience every menopausal symptom, but the cardinal one that we look at, particularly to diagnose that somebody has menopause, again, is that cessation of menstrual period, as in factory valile, closed, finish. Over and above that, things like the vasomotor symptoms, which is the hot flashes, the insomnia or difficulty in sleeping at night, those may be experienced by some women and some no hot flashes at all. The perimenopause is a little bit less defined. This is because, again, I say menopause or perimenopause is not something that just happens as a once-off. That slow decline results in women experiencing different types of symptoms. Again, lifestyle plays a big role. So how stressed you are, the kind of mitigating factors that you've kind of put in your life to deal with things like stress, how relationships are going. So any major stressor your life will almost amplify the symptoms, mood symptoms. Anybody who's got underlying mental health conditions, for example, you might find that that is amplified a lot more. So it's also not just about looking at the symptoms from the menopause, but the holistic woman that we are treating. So menopause is beyond just having hot flashes, and it would get women who have never experienced a hot flash in their lives, but other symptoms that are often not spoken about, mood symptoms, where somebody is experiencing irritability, anxiety, maybe even depression, more so for those women who already have or may have a predisposition to mental health conditions. Other one that is really big is the no sleep. So what we call insomnia. And very often this ties in very well with the hot flash, but you may not necessarily experience a hot flash. Just this difficulty in not only in falling asleep, but having a disturbed sleep throughout the night, which ultimately is a vicious cycle. You wake up cranky in the morning, your mood is already not doing so well. And those are the things sometimes where when people look from outside, we're like, I mean, what's going on with these people? Something is going on, something is wrong with their mood. But you realize it's actually a ripple effect of all the other symptoms. The other one is when it comes to what we call the genitourinary symptoms of menopause. This relates to the urinary system, which is the bladder. You'll find that there's more UTIs, person experiences more urinary tract infections, but also you'll find that they have a little bit of leakage, what we call urinary incontinence. This is all because of that estrogen and progesterone that has declined in someone's body, and therefore the muscles are not holding as well as they used to, but also you find the urethra kind of comes down a bit more than usual. Then the genital side of things, the vagina. Oh, this girl, we need to treat this girl a little bit better. Very often, the big one is within an intimate relationship where a woman may start experiencing less lubrication. So, feeling of inflammation, a feeling of discomfort during intimacy. But also, even if without the intimacy, you find that there is now a higher risk of yeast infections as well as things like bacterial vaginosis, which are as a result of that shift in your pH, vaginal pH. A lot of women will say, I don't feel like myself anymore. And it is true. Unfortunately, it's also one of the reasons a lot of women feel not seen when they go see clinicians, because very often nobody has taught us, nobody has given us the language to be able to really define what is happening to our bodies. We talk a lot about, puberty as you start off, menstruation as a young girl. And there's often a lot of grace around puberty. But as an adult, you're not just juggling your emotions, you're juggling your life, you're juggling other people's lives as well. And so very often it's the sense of feeling like your own life is slipping you away and you have no way of grabbing hold of it. And I think it really goes back to conversations like these. Let's have the conversations. Let's educate. Let's give accurate information, particularly as clinicians. And so that women can walk through the season, not feeling like they're dreading it, but also feeling empowered to be able to know that this is still all of me and I will kind of navigate and journey with whatever changes my body is taking me through. Hormones are a big part of our cyclical self as women. And therefore, whenever there is a change, a transition in our hormones, it will absolutely impact. And this is not just with menopause and perimenopause. I think I also want to really emphasize that menopause is no different to really any other phase, be it pregnancy, postpartum, puberty. But understanding and having the right information, it helps us to navigate it with a little bit more confidence. And so the mood will be impacted a great deal. Your estrogen, which is, I called it your glow up hormone, is declining. The testosterone, which is impacts particularly your intimacy life, but also energy-wise, how you show up. So that will automatically impact the mood. Again, the irritability can come from both the hormonal side of things, but also if you're not sleeping well because of insomnia, because of hot flashes in the middle of the night, you're not going to be the best version of yourself in the morning. So mood gets impacted a great deal. I think another one that we can't run away from is the grief a lot of women experience with getting older. So over and above the hormones and, the lifestyle, it's that idea that we've been sold that we're supposed to be forever young, which is not true. And ultimately what I would want, or the message I would want to communicate to a lot of women, is growing old is no better or worse off than any other phase you've ever been through. In fact, I find that anxiety and low mood are often linked to menopause. It comes in two ways. if somebody already has an underlying mental health condition that is associated with anxiety or depression, it will be amplified. It's the shift in terms of the hormones. But also, there's a lot of other things that are happening. The exacerbation in terms of lifestyle stresses, as well as the grief of getting older. But the big one, and I think it is important to highlight this, and with the conjunction when we work with psychiatrists and psychologists, it is the fact that you almost lose that protective factor that comes from the progesterone, which is calming, but also that glow up or high mood you often get as a result of your estrogen. Combined with that, very often you've got high stressor hormones like cortisol, and this will absolutely predispose somebody who either has underlying or a predisposition, whether it's from a genetic perspective or just what's happening within their environment. Menopause and perimenopause absolutely affects intimacy and libido. Whether somebody is actually coupled or not, it really doesn't make a difference. Let me tell you why, or how even. When you look at the way that the hormones decline, yes, we're back there. We will talk about these hormones until we all understand. When the hormones decline, the big one, particularly when it comes to desire, there's a sexual intimacy round. So desire is one of the first things, which is basically that desire, the wanting them. I want something. That is triggered particularly by the testosterone. Now, if that is declining, it will absolutely cause you not to feel like getting into the action. The estrogen, on the other hand, is responsible for the integrity of the lining of the vagina, keeping it nice and thick, but also for that lubrication when somebody is aroused, how the body responds. It's that sticky fluid that comes out, that nice one. Yeah. So that is why during intimacy, women are likely to experience, first and foremost, low desire. And if it is not the low desire, you'll often find that they might want to get into the sack and do some nice things. But because of the lack of lubrication, they experience pain during intimacy. And therefore, this impacts them actually wanting to continue with the session, or even starting to have that avoidant factor of not wanting to be intimate because it's going to be painful. Obviously, if you are in a relationship with somebody heterosexual or even non-heterosexual relationship, it will impact the quality of the relationship, because very often when we are shy to talk about it, the partner may read it as, oh, maybe you're not attractive or you're not attracted to me as you used to be. The other big one that impacts relationships, and it is indirectly linked with menopause, is the fact that generally around this time, we also pack up a little bit around our waist. So our self-confidence may not be as great as it was in terms of how we feel and how we look. And therefore, we bring that into the bedroom, and it comes across as now people are starting to want to have the lights switched off when they are, having intimacy. The more we talk about it, the more you explain to your partner what you are experiencing, what you are feeling, and again, putting all those other lifestyle things in place, it makes things so much easier. Women often feel embarrassed talking about sexual changes, and this is not new to the phase or the age of perimenopause and menopause. We've always had a very conservative society where sexual or sexual intimacy conversations, and particularly sexual pleasure conversations, they are never talked about, or they've never been talked about openly. And so you find a lot of women, first and foremost, have never owned their own sexual pleasure, let alone being able to just go to your partner and say, yes, baby, you know what? The Ferrari is not the way it used to do. It's doing things differently now. And again, it comes back to the languaging, the socialization, but over and above, just that permission for women to be able to experience their bodies the way that they were designed, without shame, without embarrassment. And that's why conversations like this are so, so important. Oh, man. If I am feeling cranky, if I'm feeling tired, if I'm feeling overwhelmed, if I am feeling misunderstood. I go to my gynae or a clinician and I don't get the help. What makes you think I'm going to come home and be like, honey, I'm home. Let's do the things. So our emotional selves, I often describe women almost like, a table whereby everything impacts the other. It is so important for us to be clear everywhere before we can show up. Your mind, your heart, and your genitals have to be connected for things to feel really good. So when things are not going okay, when we don't feel well, unlikely that we're going to feel inspired to go to the bedroom and swing on chandeliers. It's so important as a couple to understand that this is not a him or a her factor. This is just part of the biology. And when you can give each other grace in understanding that your bodies are changing, the phases of your lives have changed as well, you'll find it easier to navigate through this with your partner. I always say we are not managing symptoms, we are managing and walking through a journey with the woman. So definitely depends on the individual that is sitting across you, wants to do an assessment. You want to know what they are predisposed to. So we are never treating the symptoms. We are always treating, managing, and journeying with the woman in front of us. And there is an array of different options that are hormonal and non-hormonal, depending on someone's preference as well as what they are comfortable to take. Hormonal therapy can be unsuitable generally for two groups. One, medically contraindicated, a history of breast cancer, a first-degree relative that has had breast cancer, and especially if it has not been assessed appropriately. But the other person is those who have a predisposition to clotting. And then you have the other group, which we see more often now, which is preference. And that is still just as equally important because you want somebody to feel comfortable with whatever treatment you are discussing and prescribing to them. A lot of women don't have all the accurate information. Things we read here and there on different platforms may not be all the information. So being unaware, not knowing, or having incomplete information about hormonal therapy. The other reason is that someone can genuinely have had a bad impact or experience with other types of hormonal treatment, be it from a contraceptive perspective, and that can kind of leave them a bit jaded to want to try. And there's nothing wrong with that. It's so important for women to understand all the options that are available to them. So starting with non-hormonal treatments. These could be over the counter. And the beautiful thing about them is that they don't increase the amount of estrogen and they don't also use the estrogen pathways, which may flare up things that or unwanted risk factors that some women may be concerned about. Other supporting methods include just looking at your lifestyle, your diet, keeping that BMI to an absolute minimal or low. That goes a mighty long way. In terms of exercise, putting in a bit of that strength training, it helps to build that muscle. It helps also to keep the metabolism going a little bit more faster than it usually would around this time. Other things include things like meditation. Your ability to manage stress goes a mighty long way. So whether it's you meditating, whether you're doing things that bring you joy and make your heart sing, all of the above helps to manage all your symptoms in a way that is suitable for you and also works with your own quality of life. The conversation does not end here. Please do join me in a conversation. I've invited some of my favorite human beings from different spheres. They're going to share their experiences. They're going to share how they've navigated and journeyed through their menopause, perimenopause, or just being outsiders looking. Do not miss this conversation.